Colorectal cancer or cancer of the large intestine, one of the most common cancers affecting people worldwide. What are the causes for colorectal cancer? What are the symptoms? How do we diagnose it? And what is the treatment modality for it? One of the most common reasons for colorectal cancer is lifestyle, improper diet, chronic constipation. One of the most common reasons for colorectal cancer is lifestyle changes which has been happening over the centuries, and that is the reason why the incidence of this cancer is on the rise. A small group of patients also suffer from what is called as familial cancers, where because of certain genetic problems, the colorectal cancer starts occurring in every generation, and these people have to be screened at a younger age and the cancer has to be picked up. What are the symptoms of colorectal cancer? As you know, the large intestine is the part of the intestine which is involved in the last stage of digestion of food and the formation of stools. When there is a cancer or a growth in this part of the intestine, it usually presents with chronic constipation. Because the cancer growth can block the intestine, the patient may not be able to pass motions freely, and this can cause constipation. Sometimes when the tumor secretes a lot of mucus, the patients can also come with diarrhea. Many people can have alternating constipation and diarrhea. These tumors can rupture and bleed, and the patient can present with blood in the motion. Many times this is ignored, thinking that it is a small piles or a fissure problem, but actually the patient might be suffering from a colon or a rectal cancer. When the cancer becomes very big, it can completely block the large intestine, and the patient can have an intestinal obstruction wherein the motion completely fails to come out and the abdomen starts bloating, and the patient might need an emergency surgery. Cancers which have advanced beyond the large intestine, which have spread to various parts of the body, can present with symptoms of loss of appetite, jaundice, weakness, and sometimes even fluid in the tummy. This usually points to a late stage of the disease. How do we diagnose colorectal cancer? One of the simplest methods to diagnose colorectal cancer is with the help of a colonoscopy. It is an endoscope which is passed from below through the anus, and the entire large intestine is studied. Who needs a colonoscopy? Patients who have family history of colon cancer, or patients who are beyond the age of 50 who have a recent onset constipation or diarrhea or blood in the motion. These are the people who need to get themselves checked for the presence of colonic cancer. Why is it important to diagnose colonic cancer early? Because just like any other cancer, the stage of the cancer is a very important part in the treatment of cancer. If a cancer is diagnosed at an early stage, the outcomes are much better than when you diagnose the same cancer at a later stage 3 or stage 4 condition. What are the treatment modalities for colonic cancer? Like all cancers, colonic cancer is treated with the help of multimodality treatment, wherein we can use surgery, chemotherapy and radiotherapy depending upon the stage and the type of cancer. Surgical therapy is very effective in removing the primary disease, and when the cancer stage is advanced, to mop up the residual disease in the body, chemotherapy and radiotherapy is used. There are very many latest monoclonal antibody therapies available for treatment of colorectal cancer, whereby even in patients who have come to us with stage 4 disease, they can be given a meaningful long survival with the help of these latest medicines.